Good morning and welcome to today's webinar on the public health impact of the Dirty Dozen list. This webinar is presented by the Alliance for Food and Farming, a nonprofit organization with a mission to provide credible information about the safety of fruits and vegetables. This webinar has been approved for one continuing education unit. You'll receive your certificate within 48 hours at the conclusion of this webinar via email. My name is Teresa Thorne. I'm the Executive Director of the Alliance for Food and Farming. I'll be serving as your moderator today. Liz Shaw is unable to join us, but I can assure you it's for a very important and happy reason. We have two excellent speakers lined up to help us discuss how the so-called Dirty Dozen list has spread inaccurate safety fears about the most popular fruits and vegetables for over 20 years. Peer-reviewed research has not only shown this list lacks any scientific credibility, but studies have also found its message may result in low-income consumers being less likely to purchase any produce, organic or conventionally grown. Here today to help break down both of those research, we have two presenters. Dr. Winter is a cooperative extension food toxicology specialist, Emeritus at the University of California, Davis, following a 32-year career at the university. Dr. Winter's research and outreach activities focus upon chemical contaminants in food. Dr. Winter has provided U.S. congressional testimony on several occasions and has been involved in more than 1,000 media interviews. He has authored 2 books and more than 150 publications in scientific journals, books, and popular media. Dr. Winter was elected as a fellow of the Institute of Food Technologists in 2008. He received the U.S. Centers for Disease Control's Hodgkin Award in 2003, the NSF International Food Safety Leadership Award for Education and Training in 2009, and the Council for Agricultural Science and Technology's Borlaug Communication Award in 2012, the Institute of Food Technologists Award for Food Ingredient Safety in 2016, and finally, the Institute of Food Technologists Carl Feller Award in 2020. Next up, we have Toby Amidor here to explain how to effectively communicate in your respective outlets and channels this information. Toby is the founder of Toby Amidor Nutrition. She believes that healthy and wholesome can also be appetizing and delicious. In addition to her consulting services, for 12 years, Toby has been the nutrition expert for foodnetwork.com, writing for their Healthy Eats blog. Amidor is also a contributor to U.S. News and World Report Eat Plus Run blog, Shape, Muscle and Fitness, Eating Well, and has her own Ask the Expert cookbook author. And some of her recent books include The Best Ingredient Cookbook, The Create Your Plate Diabetes Cookbook, and Smart Meal Prep for Beginners. Amidor trained as a clinical dietitian at New York University. Through ongoing consulting and faculty positions, Toby has established herself as one of the top experts in culinary nutrition, food safety, and media. In 2018, Toby was awarded by the Academy of Nutrition and Dietetics the coveted Media Excellence Award. I will be also facilitating the Q&A portion of this webinar. So please, if at any point in the presentation you have questions, just type that into the question box and we'll have those to the presenters at the end of this webinar. Now, for those wondering, does the media still push the Dirty Dozen list? The answer is yes. However, attention on this list has substantially gone down over the last few years, but you can still see some major outlets continuing to cover it, leading to confusion among consumers. Thankfully, we have many nutrition communicators and educators out there we have to thank for helping to lower the impact of this list. These social media messages are just a small glimpse into the powerful role your voice can have in affecting change when this list comes out. So get ready to learn a lot in the next 50 minutes. Not only will you leave today, hopefully, with an understanding of the science behind pesticides reports and research, but you'll gain a deeper understanding of the public health impact this list has, as well as tips to reassure consumers on the safety of all produce. And now, without further ado, I will hand it over to Dr. Carl Winter. Carl?
All right. Thank you, Teresa, and good morning or afternoon, depending upon where you're calling in from here. It's my pleasure to be here today to talk about the Environmental Working Group's Dirty Dozen list. This is something that I've been involved with on and off since 1997 when they first started releasing their report. So I find it, pretty fascinating. It certainly has been popular over the years and has gotten a lot of people's attention. And as a typical scientific issue of the day, there's a lot of concern about the validity of the recommendations. So what I want to do today is sort of break it down a little bit, talk about how they compiled the list, what it means, and provide a contrast to their list with the traditional ways that we in the risk assessment community look at risk and show the differences there. So at the bottom of this slide, you can see my email. Please feel free to send me an email if you have any questions. I'll certainly try to address questions at the end of this webinar, but if you have more detailed, please feel free to send me an email. I am retired from the university, but I'm happy to continue to engage in this area. Okay, great. Okay. So in 2020, this is the Dirty Dozen list from top to bottom, where the Environmental Working Group considered strawberries to be the leader on their Dirty Dozen list, followed by these various commodities. It looks as though the 2021 list will be coming out sometime in March, and I think it's quite likely that you won't see major changes in this list. A lot of that has to do simply with the methodology that they use to develop this list. But it's important to understand what this list does and doesn't do in terms of science. The major recommendations of the Environmental Working Group for this list are that if a commodity is on the Dirty Dozen list, that consumers should consider purchasing organic forms of that commodity rather than the conventional form. So if it's on the list, consumers should try not to purchase conventional forms. They also have a similar list, which is the bottom of the list, which they call the Clean 15. So their philosophy is, well, if you can't afford or you can't find organic forms of the various commodities, then consider different commodities that are on the what they call cleaner side on the Clean 15. So there's the bottom of the list. Interestingly, I think in 2011, the number one commodity was apples. On the Dirty Dozen list, the cleanest of all the commodities was onions. So I guess if we really wanted to follow their recommendations, we might want to substitute an onion for an apple in our child's lunch. Kidding aside, I think it's important to take a look at how they come up with these recommendations and what the scientific basis is for these recommendations. So let's look at their methodology. They didn't do the analyses themselves. They simply relied upon data that was collected by the USDA Pesticide Data Program. And based upon that data, they developed 6 indicators of pesticide contamination. So they rank each of the commodities that have been tested by these 6 indicators. They look at the relative rankings, they sum them all up, and that ultimately generates the Dirty Dozen list. Now that in itself sounds fine, but let's look at some of the indicators or all of the indicators that they've used to try to figure out this Dirty Dozen score. So here are the indicators. Now, the percentage of samples with detectable residues, the percentage of samples that have 2 or more residues, the average number of pesticides found on a single sample, the average amount of all pesticides found, the maximum number of pesticides found on a commodity, and the total number of pesticides found on a commodity. So this is an interesting list, but as a toxicologist, I really question whether much of this is particularly meaningful and certainly helpful in telling consumers what they should or should not consume. If we look at the normal risk assessment parameters on the right side of this slide, we consider 3 major components. We have to consider the amounts of the pesticide residues found. It's not the presence or absence, but the amounts that are important. The amounts of the food items that we actually consume, that's going to be important. And finally, the toxicity of the pesticides. So we need to consider all of these. Now, if you look at the parameters on the right and you compare them with the indicators on the left, I think it's pretty clear to see that the indicators that the EWG really don't address these risk assessment parameters. So I find their methodology to be quite arbitrary and really particularly meaningless when it comes to guiding consumer choices based upon science. I've been responding to this report, as I mentioned earlier, since 1997 when it first came out. And I've talked with a lot of reporters about this. It's certainly of interest to consumers, and it's been popularized quite well by the EWG. But after several years, I decided, well, why don't I do a little research on this and try to break down the Dirty Dozen in terms of, just how risky it is using the three parameters of toxicological risk assessment, the amount of food consumed, and the toxicity of the various pesticides. So it's a very simple experiment I did with Joshua Katz, who was at the time a PhD student in nutritional sciences at UC Davis. And we published this work in 2011 based upon the 2010 EWG Dirty Dozen list. In our methodology, we first identified the 10 most frequently detected pesticides according to the most recent data at the time, which was the 2008 data from the USDA Pesticide Data Program, on each of the 12 Dirty Dozen commodities. From there, we looked at the exposure assessments by looking at food consumption of those various commodities multiplied by the levels of pesticides that were showing up. And then we compared these exposures with the reference doses that are provided by the Environmental Protection Agency. Briefly, the reference dose represents the maximum amount of exposure to a pesticide on a daily basis that is not considered to have any real potential for harm. So if your exposure is below the reference dose, then we really are not particularly concerned about this. So this was done for each of these individual pesticide commodity combinations. What did we find? Well, not surprisingly, no exposures of the 10 most frequently detected pesticides on the 2010 Dirty Dozen commodities were anywhere near the reference doses. Let's put this in a little bit of perspective. Only 7 of the 120 exposures, the 120 commodity pesticide pairs, exceeded 0.1% of the reference dose. So those were the highest levels of exposure, and they were still only around 0.1% of the reference dose, so far below the reference dose. 75% of the time, the exposures were less than 1/100th of a percent of the reference dose. And one way to make some sense out of this is to back up a little bit and compare the reference dose, or compare these exposures with levels that don't cause effects in laboratory animals. And generally, a dose of 1/100th of 1%, 1/100th of a percent of the reference dose is equivalent to 1 million times lower than doses that cause no effects in laboratory animals when we feed them to the laboratory animals on a daily basis throughout their entire lifetimes. So to me, that's a pretty significant indication that most exposures to pesticides on the Dirty Dozen list are well below the levels of toxicological concern. Now let's break this down a little bit further. This is kind of an awkward statement, and I recognize as a scientist, it's hard sometimes to make some sense out of this. So 75% of the exposures are less than 1/100th of the reference dose. What does this really mean? Is this really easy to understand? So let me take you through a different scenario that looks at this. So just down the road from where I live is the city of San Francisco, and the population is slightly under 1 million. But let's just call it a population of 1 million in San Francisco, California. So let's say our goal is to make sure we feed the population of San Francisco. So we'll prepare all of the food for all the residents of San Francisco for a particular day. But instead of giving it to every resident in the city of San Francisco, we find one person and we give them all that food. And we don't just do it for one day, we do that for a 70-year period. That level of exposure to pesticides is still not going to be of a level of toxicological concern. So that's obviously a ridiculous scenario, but it does give some indication of just how much exposure would be required before toxicological concerns, and certainly our typical exposures are far less than that of toxicological concern. So I've talked a little bit about just specifically looking at the certain pesticides on the Dirty Dozen list And that doesn't tell you what our typical total exposure to pesticides are. So in my last couple of minutes, I want to walk you through a scenario that addresses this question. What are the risks from pesticide residues in foods? So to address this, first thing we can do is we can look at what we consider to be our best estimates of daily human dietary exposure to pesticides. We'll call that X. So I use as an indicator of X results from the Food and Drug Administration's Total Diet Study. This is a market basket survey that's been done for decades now, in which Food and Drug Administration officials purchase food at retail outlets, presumably just as you and I would, prepare those foods for consumption, and at the time they're ready to be consumed, they're analyzed for pesticide residues. Knowing how much of those various food items we typically consume, it's possible to develop crude estimates of what our typical daily exposure is to pesticides. So let's call that X. Now we're going to take this level of X and we're going to multiply it by a factor of 10,000 times. Okay. Now after that, we're going to feed that level 10,000 times our typical exposure to laboratory animals every day throughout their lifetime. So in the case of a rat, that would be every day for 2 years, the rat would be getting an equivalent dose of 10,000 times what our typical exposure is to that pesticide. We can ask the question, what happens to the animals? And generally, no adverse effects are observed. So when animals are exposed to 10,000 times our typical daily exposure to pesticides, that's not a sufficient level to show any toxicological effects in the laboratory animals. Now, this doesn't prove safety, but it certainly is one indicator why most health professionals do not consider the risks from pesticide residues in foods to be particularly large. Another concern I have, and I think Toby will talk about this in greater detail in just a couple of minutes, is that consumers need to eat fruits and vegetables. They're one of the healthiest things the healthiest thing that consumers can eat. And if they're concerned about pesticide residues, or if they're spending money that they're not comfortable spending to buy organic produce, then that could decrease their consumption of fruits and vegetables. I think it's great that consumers have choices. We're very fortunate that consumers have choices, and we make our purchasing decisions based upon a variety of different factors. But simply from a pesticide food safety standpoint, it's really hard to argue that consumers should be following the Dirty Dozen guidelines of avoiding the Dirty Dozen foods. The most important thing you can do is eat fruits and vegetables and grains by far. This also doesn't really touch on issues of environmental impacts of pesticides, worker exposure. I haven't talked about that. Workers tend to be, can be exposed to far greater amounts that you and I as consumers are exposed to. So we do need to keep an eye on how we produce our foods and look for the best ways to produce foods. But at the same time, we're really not looking at evidence indicating that consumers are facing any harm because of the trace amounts of pesticide residues that are showing up in their commodities. So we sort of get this dichotomy here. If you eat, you're going to die. Yes, food does have inherent risks in it, but if you don't eat, you're probably going to die a lot sooner. What I want to make sure is that consumers eat plenty of fruits and vegetables and whole grains and feel good about that, feel good about feeding their families. So with that, I'll go ahead and stop, and I guess I'll turn it back to I'll turn it right over to Toby. Thank you, and I'll be back for questions.
Thank you, Dr. Winter. Toby will be joining us next. I do want to remind everybody the question box. Please enter any questions you have for either Dr. Winter or Toby into that question box, and we will read them at the end of the presentation. With that, Toby, I will turn it over to you.
Great, thanks so much. So I'm going to be touching upon the public health impact of the Dirty Dozen list. And give me a minute to see if this does not go. Nope, not moving. Okay, yay. All right, so if you took a look at the 2020-2025 dietary guidelines, you can see this really nicely done chart that does show that Americans are eating below the recommendations for fruits and vegetables. And if you go down to the vegetables, it's about 90% and about 85% are not eating the recommended amount of fruit. And they actually can go by the subgroup of the fruits and vegetables there. So it became very specific compared to the 2015-2020. They actually had something like this, but not as specific. But bottom line, we continue to eat less fruits and vegetables, a lot less than what's recommended. And we also have a tremendous amount of consumer confusion, okay? So you hear conventional, you hear organic, local, ugly, what's better for me? Is one healthier than the other? And there's so many choices around, and there's so many varying voices, different voices telling you different things. And you can find so much online that it's no wonder that consumers are confused. And let's take a look at the media. So in the media, you see a lot of conflicting headlines with regards to fruits and vegetables. So here's something from Health that was published earlier this month. Is it really that bad to eat non-organic produce? Right there, the headline is saying, okay, obviously it's not as good as organic if it's non-organic. An Insider you saw, you could see below, also published a few months ago, what you need to know about organic food, if it's better for you, the benefits, and the best foods to buy organic. So clearly, the headline is saying that organic there is better for you, which certainly confuses customers. But it's actually a little bit more than that. If you look at the reality, here's a study that was published in Nutrition Today, and it's about low-income shoppers and fruit and vegetables and what do they think. And so the study design were 510 low-income shoppers, and researchers surveyed these shoppers to learn about their attitudes about eating organic and conventional produce. They were examining to see what would happen if they provided these individuals with information about organic and conventional growing practices from a variety of sources. And so what the results found were that there was a preference towards organic fruits and vegetables. One of the biggest barriers to purchase was cost. The information statements about organic and conventional fruits and vegetables did not increase likelihood to buy more, but they did find messaging naming specific fruits and vegetables with pesticides shifted participants to less likely purchase any type of fruit or vegetable, regardless as to whether they were organic or conventionally grown. And so what they really found from this was that individuals, cost was a significant barrier. After they're hearing specific messaging, they're scared to buy conventional, thinking it's not good enough for their families, but they can't afford organic. So guess what? They didn't buy any, which completely defeats the purpose. So the results really provided insight about how low-income shoppers view fruits and vegetables and how communication really can influence the purchase intention. There was also another survey of registered dietitians better understanding challenges of increasing fruit and vegetable consumption. And this was a study that was done by the Alliance for Food and Farming. It was done with 175 registered dietitians who responded to a web survey. All the participants had at least 10 years of experience as a registered dietitian, and 97% stated that they worked directly with consumers and with the majority in the medical and healthcare field. And so I'm going to read 4 statements that you'll find very interesting. 99% of these registered dietitians agreed That is, it is extremely or very important to eat enough fruits and vegetables each day. 95% agreed that it's important that consumers know that conventionally grown fruits and vegetables are safe to eat, because not all consumers feel they can afford organically grown produce. 94% agreed that fear-based messaging regarding pesticide residue has a negative impact on consumers because it causes concern about whether conventionally grown fruits and vegetables are safe to eat. So these are the same things we found in that previous study. 93% agreed that consumers should eat more fruits and vegetables every single day, whether it's organic or conventionally grown. Both are safe and can absolutely be eaten with confidence. And let's also look at these 5 produce facts. The Alliance for Fruits and Vegetables website, safefruitsandvegetables.com, has a tremendous amount of education material as well. And this is one of the handouts up there, and I really do like this. So the first point is we don't eat nearly enough. And according to the Centers for Disease Control, only 1 in 10 Americans are eating enough produce every day. And we saw the same thing with the dietary guidelines. Number 2, slight increase can prevent disease. So very interesting statistic. If half of Americans increase their consumption of fruit and veggies by a single serving each day, 20,000 cancer cases could be prevented annually. Washing removes residue. So washing organic and conventional produce under running tap water often removes or eliminates minute or very small amounts of residue that may be present, and this is according to the FDA. People who eat more are happier. So a peer-reviewed research shows that mental well-being rose in accordance with the amount of fruits and vegetables people consume. So just another reason to have more fruits and vegetables. And continually tested for safety. So as we heard just beforehand, over 99% of the produce sampled by the USDA had pesticide residue levels well below tolerances established by the Environmental Protection Agency, and 50% of foods sampled by the FDA had no detectable residue level at all. So I wanted to point out, I love using this pesticide residue calculator. I gave you the website on safefruitsandveggies.com. And what you can do is it has the top, a lot of the top fruits and vegetables that you might see in the Dirty Dozen list and others that are popular as well. And you can choose male or female, adult or child, and calculate how many servings you would need of that fruit or veggie in order to get just a touch of, if any, residue. So here, I did a male, and a man would have to consume 18,519 servings of blueberries in one day. I mean, I love blueberries, but that's a lot of blueberries. In one day without any effects, even if the blueberries here had the highest presence of pesticide residue, okay? So just to show you that is a lot. Pro-choice dietitian. So I'm what they call a pro-choice dietitian. I always try to look at the most positive things, first of all, when it comes to fruits and vegetables, and it's up to the consumer, not me, to decide if they want, for whatever reason, to choose conventional or organic or ugly or local. That is up to them. I can just provide them with the information. So it's important to realize that, because if someone says only eat organic X, Y, and Z, and a consumer says, I cannot afford this, or whatever reason, I don't have it available, that's not fair. Then you're telling them whatever else they choose basically is subpar, and that is incorrect information. Okay, and so I've actually written that type of information in articles on US News Eat and Run, and that article was called "When It Comes to Food, Why Aren't We Pro-Choice?" And also in food safety news. I've been called a pro-choice nutritionist, calls out produce guides, and I gave a lot of the information that you're hearing today over there as well. And so when it comes to media, because I do a lot of writing and I get quoted a tremendous amount in the media, I always try to give positive messages to the readers. Okay, I don't like to bash anything. I don't want to think negative. What can they do in their eating pattern to increase it, to make it healthier, to increase fruits and vegetables? And so here are some examples. Number one, keep messages positive. Okay, so how do we do that? The RD survey, which I showed you before, they included some positive messages that can help encourage consumption. So 95% agreed that government dietary recommendations, which encourages consumers to fill half their plate with fruits and vegetables, that's a nice positive message. How can I, so it's a how can I do it message. Fill half your plates. Oh, I can do that. So that's more of a positive message. 95% agreed that studies showing the reduced risk of illness, disease like cancer, heart disease, and diabetes are associated with eating a diet rich in fruits and vegetables. So what's in it for me if I eat it? I can have a reduced risk, a positive effect for all these illnesses. And so here are some things that I've written before, showcasing some of these positive messages. So 12 easy ways to sneak veggies into your morning meal. I remember going to a bed and breakfast before I was giving a talk and speaking to the groundskeeper and the woman who made me breakfast. And she was telling me, we had this whole conversation how no one in the morning at the bed and breakfast wanted to have vegetables in the morning. So I thought, hey, it's a good time to write an article about that. Of course, I'll pick out the stats showing that most people do not meet the recommended amount of fruit and vegetable intake. But I also then continue to give positive messaging to showcase the nutritional value of vegetables and also the multitude of health benefits that are associated with eating vegetables. And eat this, not that. So I was interviewed about washing fruits and vegetables, specifically the triple wash. So a lot of individuals, they like reading messages about little things that they're doing at home with their food. So for example, a lot of people rewash their triple washed lettuce packs, but you don't have to. It is not recommended. And that's kind of what I was saying while the other person was saying something else, the opposite. And so I actually brought in my own experience from visiting in California. I did visit a triple wash facility, and I point out that it's probably cleaner than your own house and your own kitchen. And then I just give instructions. If something is not triple washed, then of course you can wash it in your own, kitchen. Just be careful with the cross-contamination. But just those aha things help people think as well. And then the other aha from Well and Good, this trick from keeping my half avocado from going brown blew my mind. Again, positive messaging, aha, fun tricks and tips and hacks that people like, will get them reading. Other ways to provide positive messaging with fruits and vegetables are recipes, and I have a ton. On the left is a white bean and spinach dip that I developed for my website. On the right was from my Create Your Plate Diabetes cookbook. You can see the collard greens and yellow squash, and half your plate right there is fruits and vegetables, or vegetables in this case. And on my social media, I just started recently doing positive messaging with Toby's tips, and these tips you can also find in all of my cookbooks. But on the left is about storing potatoes in a cool, dark place. People like these, again, these storage tips for all your foods because sometimes they're not sure of them. And then on the right is kind of like, okay, my salad is soggy because I'm keeping the dressing on it. So my just simple tip is to avoid that soggy salad. Toss that dressing right before you eat, not before you're storing it. So, just a quick aha tip. And again, this is on safefruitsandveggies.com. You have positive attributes of all these fruits and vegetables. And so just pulling out positive attributes, whatever they may be, from flavor to texture to nutritional value, all these positive attributes can be brought up to clients, to the media, to readers. And so I do want to bring out a challenge. Do challenge yourself if you work with clients, if you speak to the media. Think about 2 ways that you can incorporate positive messaging into whatever you're doing in your practice, in your speaking with the media. Think about it. Think about it today after this webinar right now. How can you make a difference in a positive way to other individuals to help increase fruit and vegetable consumption, any kind of fruit and vegetable consumption? And so recommendations for dietetic practitioners and for really anyone in the healthcare field, you do want to make clients feel good about whatever choice of their fruits and vegetables, whether it's organic, whether it's conventional, whether they only choose local, or if it's the ugly produce that they're choosing. As long as they're choosing fruits and vegetables, they should feel good about any of those choices. Be mindful, please. The dietary guidelines did a wonderful job pointing out to practitioners to really be mindful of budget and really be mindful of someone's cultural background so you make appropriate recommendations. So I do urge you to always keep that in mind with whatever audience you're speaking to. That pesticide residue calculator, I love showing it. I show it to students in my classes, to clients. I've even mentioned it numerous times in the media. It really does that aha when you realize you need so many thousands of servings of blueberries, for example, as a man, to even remotely get a little bit, if any, pesticide residue. And then you have the Produce for Better Health Foundation is another wonderful resource. They do offer continuing education webinars on this topic and a great newsletter from fruitsandveggies.org. And the Alliance for Food and Farming also has wonderful resources about produce safety, the science, some of the handouts that I showed you at savefruitsandveggies.com. So that is it for me. Thank you.
Thank you, Toby, very much. We will move to the Q&A portion. I thank everyone for their questions. Carl, if you'll enable your webcam. I think this first question probably could go to you, but maybe it's better for both of you. What do you think is the motivation behind EWG's message of avoiding conventional fruits and vegetables on the Dirty Dozen list? Do you think they realize the damage this has done providing consumers with this incorrect message?
Well, I'll take a shot at that. I really can't comment on motivation. I think it's very dangerous to try to figure out what motivates different people. I think we are dealing with, there is a big values issue here, which can guide preferences and approaches to controversial issues like that. So, I think it's been made clear with, particularly some of the work that your organization, Teresa, Alliance for Food and Farming, has done, as well as other papers, the one that Toby referred to about consumer preference, that there are the potential downsides for consumers following that particular guidance. But as far as the motivations, I think that's a question that really has to go to that organization and not to me.
Toby, anything to add on that?
No, I agree with Carl. The motivation we cannot speak to, but we can speak to the consequences of their messaging, and which is very clear. It's also very clear that we don't eat enough fruits and vegetables, and there are a multitude of health benefits eating conventional, organic, ugly, any of them. And so that's everyone should feel good about any choice that they make. And that really should be the ultimate message.
Toby, I think this next question is for you. Did you notice a change in the Dirty Dozen list's impact in 2020 due to the pandemic changing consumers' priorities?
I noticed that a lot more registered dietitians were really unhappy with that Dirty Dozen list and really not in line with that list. They were again focused on just eating conventional organic, didn't matter which, but just getting in overall more fruits and veggies. And this was especially important during the pandemic when there wasn't, people didn't even, they were scared to go to the stores. They didn't have enough fresh even in the house all the time, so they did have to rely on canned and frozen. So that entire message really got lost. People were actually afraid of fresh during the pandemic because they weren't sure how COVID was spreading, and we do know that COVID is not a foodborne illness, so there's no issue. You just have to rinse your fruits and vegetables as usual. So I think really the registered dietitian world, at least that's where I come from, they really were, it didn't impact them and it didn't make as much media headlines as it usually did, which was very positive, thank goodness.
Thank you, Toby. The next one is for Dr. Winter. Dr. Winter, you said the Dirty Dozen approach falls short of good science and showed us your 3-point methodology. Can you explain with more detail how you go through those 3 steps to determine actual risk and danger?
Okay, that's a great question. We'll start with the first one, which is looking at the amounts of residues on food. We have a wealth of sampling programs out there. The USDA does the pesticide data program. We have the Food and Drug Administration's routine marketplace surveillance survey. We have a lot of programs such as in the states, such as what California Environmental Protection Agency does, Department of Pesticide Regulations. So we have a lot of data out there that consistently demonstrate, as I think Toby mentioned in her presentation, that the typical levels of pesticide residues are far below the allowable levels. And I can take this a little bit further for any of you who really want to get into the weeds with this, and that is that the allowable levels themselves are set much lower than they have to be to still be protective of food safety, and that's because they're set on the basis of good agricultural practices. If you use a chemical according to the directions, you shouldn't have a residue that exceeds the allowable level or the tolerance. That doesn't mean that that the tolerance is of any health concern. And I've published some pretty old and obscure papers that go into that. So if any nerds are out there that are interested in that, I'm certainly happy to talk about that. So we have a lot of data that shows the typical levels of pesticide residues, even when residues are detected, are far below the levels of concern. We also have lots and lots of really good food consumption estimates. We can break it down by gender, ethnicity, age, various types of things. And we have pretty good data that shows what typical people consume. So when we take the food consumption levels and the pesticide residue levels, we actually have some really good models that allow us to do what we call a Monte Carlo simulation, where we can look at the consumption and the residue levels as distributions. We can put them all together and we can then have a nice prediction as to how much we're actually exposed to in foods. And we can also look at the worst case scenarios. Who are the really high consumers of these particular foods? What would be the chance of exposure if the high consumers are consuming the highest levels of these particular pesticides? So finally, then we compare those exposure estimates, which are the product of the food residue levels and the food consumption estimates. And we compare those with the reference doses. Again, the reference dose is set to be what we consider to be the level that a human could be exposed to with absolutely no potential for risk. To do this, we look at the most sensitive animal species in a long-term feeding study. We look at the most sensitive effect in that animal species. We try to figure out the highest dose that we can give that animal that doesn't show that particular effect. And from there, we generally reduce that by a factor of 100 to determine what's going to be acceptable for humans, assuming that some humans are going to be more susceptible than other humans, so we assume that some might be 10 times more susceptible. We also assume that humans might be 10 times more susceptible than the laboratory animals that we're studying those. So based upon that, we get the reference dose. When we look at the exposures, we compare them with the reference doses. The typical exposures are tiny, tiny fractions of the reference dose. So to me, as a food toxicologist, that provides a very large cushion for human safety, particularly when contrasted with the demonstrated benefits of eating lots of fruits and vegetables and whole grains.
Thank you, Dr. Winter. The next one, I believe, is for Toby. Toby, in your experience in the media, is it true that more and more media chooses not to publicize the Dirty Dozen list?
You know, I've been interviewed continuously on the Dirty Dozen list, and I find that there still is media that is publishing the Dirty Dozen list, and I'm usually put in there, not always, but sometimes I'm put in there to like, oh no, this person doesn't agree with the Dirty Dozen list to go in there. At least I'm getting some sort of say in the media to these outlets. Certainly not as much as before, but there still are some out there right now.
Thanks, Toby. The next one kind of jumps off your previous answer a little bit, Dr. Winter, but we do have a question regarding, we often hear about multiple residues on a fruit or vegetable. Can you address that issue for consumers?
Yeah, and it's a really, really good question. We're not just exposed to a single pesticide on a single residue, but the principles of toxicology still hold. We have the first principle of toxicology is the dose makes the poison. It's the amount of the chemical, not its presence or absence, that determines the potential for harm. And while we've been able to identify in a few cases where the presence of one particular chemical could possibly affect the toxicity of another chemical, generally we find that that's also dose dependent. And you have to have a sufficient amount of one chemical that's going to affect some sort of biological form, say an enzyme pathway in a mammal or in humans, before you're going to have any effect at all. So if our typical exposures continue to be at tiny, tiny amounts, small fractions of what might cause the most tiny toxicological or biochemical impacts, then we really don't have much of a chance for those multiple residues to be impacting each other. If they were present at much higher levels, yes, that might be a different question, but we have decades of data showing that the levels of residues in foods are traditionally so far below levels of concern that the potential for them to be augmenting other residues and their ability to cause toxicity is really minuscule. We can't ever design a scientific study to prove that. But I think the important thing is to look at the principles of toxicology, look at the fact that the dose makes the poison, look at the dose that we're getting, and draw conclusions from that.
Thank you, Dr. Winter. The next question is for Toby. Toby, is the Hispanic community more vulnerable for eating fewer fruits and vegetables when this kind of scary message reaches them?
Well, there is the Hispanic population, according to the 2020-2025 dietary guidelines, are certainly one of them that are listed as low income, potentially low income. So yes, they can, especially if this messaging, and you saw that study that I pointed out was for low income individuals, that they could not afford organic. And so they were afraid because of that messaging, the fear-based messaging, to buy conventional. And so what happens is they're not buying any vegetables at all, which defeats the entire purpose. So if you are working with clientele or population that is Hispanic, that's certainly a really important message to point out to them. If they're nervous about it, for some reason, you can tell them, then just rinse in just water. If there is a minute amount, it will get rid of, anything up there, on the fruit or vegetable if it is there. But that's it. But it really is important to cover these key facts in the education component of whatever you're doing for your outreach.
Thanks, Toby. Dr. Winter, have you ever had discussions with anyone from the environmental working group, the authors of the Dirty Dozen list?
I think our discussions have been sort of mediated by reporters, where a reporter will ask me, well, this person said this, how do you respond? And I'd imagine that there's a bit of a reciprocity there. So I haven't been on programs specifically with them, but I think our messages are out there. So the information is there. One thing I take pride in a little bit is the 2011 paper that I published with Joshua Katz. And in that paper, we cited, I think, the 2010 EWG report that said that if consumers avoid conventional forms of the Dirty Dozen, they can reduce their pesticide exposure by 75%. And obviously, looking at their methodology, there's no way to substantiate a claim like that. And the fact that we were able to discuss that in the paper, I think allowed us to find that in subsequent iterations of the Dirty Dozen, that language had disappeared. So there's a case where good science gets out, and it's pretty hard to defend the indefensible.
Thank you. The next question may be for both of you. Is there any increased benefit to using vinegar to wash your fruits and vegetables?
I'm happy to address that because I wrote a tremendous amount when COVID hit. I wrote a tremendous amount in terms of just removing anything, and the answer is no. I know even people do it with their meats. As a cultural background, people do it too. But no, it's not going to do anything. If you're going to wash any of your produce, it's cool running water. If it has a rough exterior like a melon or potato, you can use a stiff bristled clean brush just to get at the outside a little bit. But that's it. There's nothing else to do. A lot of people try to make it more complicated, but really that's it.
I guess I would agree with that. Not only vinegar, but produce washes that you can purchase. I think the best advice is just to use running water and make it easy for yourself.
And our next question, Dr. Winter, how would you explain what happens to the pesticides? Is it true that the plant uses it to resist pests and therefore the residues are much less by the time the plant is harvested?
Well, a lot of what happens to pesticides depends upon the pesticide and the environment in which it's applied. But most of the pesticides that are in use today break down pretty rapidly in the environment. And much of this is just due to the natural environment, temperature, water, other types of things, evaporation, depending upon the characteristics of the pesticide. So it's easy for us, and one of the types of data that we use is to try to identify the decay curve. So when we apply a particular pesticide, you can watch the levels decrease pretty fast over time. And so it's possible to make predictions as to what happens. Most of that is not happening, say, inside the plant itself. Most of it is simply just the normal degradation of these products in the environment. Just as we have other consumer products that you have for a while, and then their efficacy goes down after a while. It's the same kind of thing that happens with pesticides. But generally, most of the pesticides that are commonly used today in agriculture break down pretty rapidly in the environment. So that's why we do see the scenario where you can apply a pesticide to a crop, but by the time you actually consume that crop, there's very little residue. Much of the pesticide application goes to the plants prior to the food part of the plants even being produced yet. So you might be spraying to control a certain bug that's going to affect how the plant grows, but this is long before the edible portion of that food is even developed yet. So you're not going to have exposure on that edible portion, even if pesticide residues or pesticides had been applied.
Thank you. And as we get to the final minutes of the webinar, this will be our final question. This is for both of you. As educators, we want to believe that the public is smart, and we don't want to underestimate their potential to understand complicated messages. Can the public understand that we can't get to absolutely no risk? This thing about the dose make the poison, implying that there's minuscule amounts of pesticide and chemicals, Can the public own that truth?
All right, we're stalling here. We're looking at it. I have a lot of confidence in the public. I think that people are, the problem is not enough information. The problem is too much information and trying to figure out who are credible sources. And we have a collision of marketing and other factors that can influence this. So it's very difficult. We're all consumers. We all make decisions based upon a variety of information. And whether you're an academic scientist or a registered dietitian or anyone else, we still make a lot of decisions based upon values and things that are well beyond the scientific realm. So I think the key is that you're not going to reach everybody with every message. We've certainly seen that in current events today. We certainly have a lot of polarization and beliefs that really don't seem to be reconciled at all. But I think we have an opportunity here in the education of food, because food is personal. We derive pleasure, we derive nutrition, we derive cultural significance from having food and having food in the presence of others. So we all have this experience of food. So I think that there's a built-in bias there for people being interested in food, and that at least allows an opportunity to have these discussions. But you're not going to reach everybody. But I think the important thing is that you're reaching a lot of people that you never hear from. And I think that's important because that tends to be the majority of the population.
No, I agree with you completely. And food certainly is an emotion that, it tugs on those, emotional strings that everybody has. So they might hear one thing but I agree with you that having these discussions and having the information available now widely on a variety of websites is really, especially the Alliance for Food and Farming, they have wonderful, I was just poking around today too, but they have wonderful resources and the science there. So you can really see what's going on and take the time to understand everything.
Well, thank you both for excellent presentations today. I should note that in the question box, we got several very complimentary comments about the presentation and how informative it was today. So thanks everyone for attending. We'd love to remind you, as Toby just did, of the resources available on safefruitsandveggies.com, pesticide residue calculator, which we've talked about a lot today. And for those nutrition communicators on the webinar today, we do have a special dietitian page for you. And last but not least, the simplest thing we can all do, which Toby talked about today as well, is wash your fruits and vegetables. We do have a graphic available on safefruitsandveggies.com that you can utilize to help provide consumers with information on how to properly handle and wash produce. Please remember, for those that qualify for this, you will be receiving your CPEU certificate within the next 48 hours via email. If you have any questions at all, please don't hesitate to reach out to us directly at the Alliance for Food and Farming. And with that, we wish you all a wonderful day, and thank you again for your time, and thank you to Dr. Winter and Toby Amidor. Thank you.